Greetings, my fellow nurse brothers, nurse sisters, nurse fam, nurse gang. So, looks like you guys been MIA for a minute. What's going on over there, y'all? I've been getting a little skeptical over here on my side. No, I'm serious though. Let's get back to the $1,000,000 question of the week. And this comes from my nurse fam right here. And I gotta do a nursing shout out, so listen up to the name. It took me like 3 times to say it, so it was hard for me to get it down. Magnus Kingston, I want to say thanks for following, asks, thoughts on your new grads getting experience on a med-surg floor before specializing or going straight into specialty. What are your thoughts on that? I would definitely say if you have a chance to go into critical care, do it. Don't hold yourself back. You go into critical care, you have an ICU experience, CVICU experience, NICU, SICU, MICU. Yes, I just did a bunch of abbreviations. But when in critical care, it's nice to get all that under your belt. They'll probably do critical care core classes, you get all that specialized, and they'll do some training. You have to pass all these tests, exams before you go onto the floor. You won't be able to do it on yourself without training. So they'll give you some significant classes and courses and a lot of training before you do go on that route. And then you also have, you know, a preceptor for 3 or 4 months, maybe less, and then you go solo. Because, and let me tell you why, when you go in critical care, you're going to have patients that, you know, let's just say if they come in, I don't know, cabbage or something, coronary artery bypass graft, or they do a triple bypass, they're going to come in with a PS1's cath. You have to look at therapeutic values and, you know, norm numbers on the monitor. What if they go into sinus brady? What if they go into VTAC, VFib, AFib? You have to know the meds, what to push, how to, you know, get all that situated, and learn how to be calm in situations that may arise. It happens. You're doing blood glucose checks every hour. You're looking at the monitor. You might follow up and you have to monitor the output every hour. You're at the bedside. You're not leaving, guys. You're right there at the bedside, monitoring and passing meds, administering it if they have, they're going to probably be, they will be intubated. So you have to know the mechanical ventilation settings, tidal volume, PEEP, the FiO2, respirations. You're doing follow-up ABGs. What if they do a sprint extubation? So you have the RT on board, doc on board, and it's nice because you have the doctor there at the bedside. It's pretty cool. But you can't mess around. You're pulling blood samples probably every hour, every 2 hours. You're following up, making sure that the patient's doing better. And you don't just have one, guys. You got 2 patients. So you're going to be on your toes. You may have one patient getting dialyzed, looking at the pressures. They may be sedated, restrained. They may be whatever their situation is. While your other patient, just came back, from cath lab, and I don't know, they have an external pacer. They're going Brady. Suddenly you have to put the external pacer back on. You might need some atropine, whatever. So it's some crazy things that may occur on the floor, but it's challenging. And when you have critical care, you don't have time to sit there and ponder. You have time to strike. So you have to be on your toes and get stuff done. So I would definitely suggest, guys, that was just a little small sample in the ICU and CVICU or SICU or MICU. I can go on for days. But I would definitely say start med-surg tele, surgical floor, get some experience on that floor, time management, get the basics down, learn what you need to know on that floor so when you do go into critical care, it won't be challenging and you won't be terrified and overwhelmed all at one time. So that's a great question. Hopefully I answered it. And I got to say your name one more time because that was hard. Magnus Kingston. I don't know if it's a guy or girl, but I just got to tell you, if you're a girl, that's an awesome gangsta name. If you're a guy, that's still a gangsta name. So I would want to just say, guys, get ready for October. We got something lined up with me and Katie Duke, Nurse Mo, and Med Jobbers. We're going to actually do a nice Bahama, cruise convention. We're going to be networking. We got some job placements for you guys. Stay on tab with that, so stay focused and get ready for some more information on that, guys. My fellow nurse brothers and nurse sisters, stay tuned. We got another couple videos coming up. Don't forget to follow me on Instagram, on here, YouTube, Facebook, and Periscope, and I don't know, all these other social media sites, y'all. So keep following me and drop some comments on the bottom. Love you guys. Stay tuned. I'll talk to you guys later. Peace.